And interestingly enough, as a small fun fact, our next speaker competed in the Eurovision contest, which is very similar. I had to look this up myself, but very similar to American Idol, where you present or perform your own original music. And she shared the link with me, YouTube link, and I watched it. And if that has any insight into what we're in for, it's a real treat. So with that, can we please give a warm welcome to Dr. Greta Smidt. Thank you.
20 minutes. That's the amount of time I have to give a presentation to you to hopefully teach you something new today. 20 minutes is also the amount of time I have to find the clicker. 20 minutes is also the amount of time that it would take a skilled team and provider after tooth preparation to scan, design, print, and begin to deliver an entire quadrant of 3D printed dentistry. In today's world, we are living in a dilemma. You have all experienced it this morning. We live in a world of innovation. There's something new happening every single day, something new and improved. When do you decide to dive in? When do you decide to make the purchase of that one thing that will make your practice more accurate, more precise, more efficient? How do you make decisions to better your practice and help your patients? And today we'll be discussing exactly that. So in order to do that, I'm going to take us back to the 1990s. This room is filled with skeptics and slow adopters. I want to show you a few things that we as a collective dental society have embraced, very briefly, just to warm your hardened hearts. In the 1990s, we started embracing digital radiography. This is something that I'm willing to bet 100% of dentists in this room utilize in their daily practice. And we know that it's been great for patients, decreased radiation, improved resolution. We can talk to our patients on the same day that we make these radiographs, and there's no need for a dark room anymore. And for providers, of course, it's helpful for us to communicate rapidly with our patients and our colleagues. This is something that is accurate, precise, and efficient, and has helped us with our patients and to improve our practices. Something else that tried to do something similar is the CEREC machine, which was wildly introduced in 1994. For patients, this was great. It gave them same-day definitive restorations, and then for providers, it helped us with chair time, made us a little bit more efficient. We don't have to see a patient on another appointment, but these machines are extremely expensive. They're very finicky, and they're hard to use for us today. This is considered a worldwide marketing failure, actually, in that fewer than 1% of dentists worldwide own a CEREC machine, and fewer than 8% own one in the United States. This has left a hole in the market for something that can give us precise, accurate restorations on the same day, which is, spoiler alert, being filled by printed dentistry, aka stereolithography. And it should give every single person in this room pause to know that this technology has been being developed since the 1980s. That was super surprising to me. And advances are happening every single day. Printed dentistry isn't new or trendy, it's just that the materials have gotten so much better in recent days that they're starting to become more comparable to our definitive restorations that we're using today. But in order to understand printed dentistry, we have to go back to, again, the 1990s, where we all began embracing adhesive dentistry. I'm bringing this up to bring 2 points. The first is, this is something that we have embraced, even though it has a lot of disadvantages, in order to give our patients metal-free, aesthetic, same-day dentistry. The consumers demanded it, and so it became. For providers, this is more technique sensitive. It's costly. You need a huge armamentarium to be able to deliver a very good Class 2 composite restoration. It's accurate, yeah, it's precise, but again, Dr. Ruddle, everyone's using your X factor comment today, but it depends on the clinician. Wouldn't it be nice to be able to make every clinician more efficient across the board for our patients and their outcomes? Oh, can we go back one? Please? Do I do it? It's going way forward. Hold on. Spoiler. One more. Okay, great. The advantages, again, of same-day dentistry, we all know. This is the incredible work of Dr. Ana Coelho from Brazil. I do not claim this work, but there are incredible direct resin artists amongst us. And they are creating work like this, and they are showing their work after 5, after 10 years, and it looks nearly the same. Direct composite can be considered a definitive material. It's my job to show you something new that may be able to make us be able to give restorations like this in a way that's the same across the board. But as a collective society, we've embraced some disadvantages that are well known for direct composites. There's high polymerization shrinkage stress, try to say that 5 times fast. There's microleakage, increased recurrent decay around these restorations, and poor contacts, and again, it's highly technique sensitive. This is not fun. If you see that you have a disease control of an entire quadrant for a patient when you walk in through the door at 8 a.m. on Monday, it becomes not as good on Monday. But I have great news. Printed dentistry is solving for these issues for direct composites. And the first study I'd like to bring to your attention is by Dayak et al. From Dental Materials in 2015, and they looked at 3D printed hybrid resin ceramics versus direct resins. And they said, okay, let's start with the first problem, polymerization shrinkage stress. And they found that direct resins, even when completed as perfectly as possible, had 13 times more stresses concentrated at that material tooth junction than 3D printed resin ceramics, which to all of us should make sense. This is an indirect restoration that is being cemented or bonded into the tooth. It should be bonded. Another study completed by Oswello et al. Also looked into this, but took it one step further and brought Emacs into the equation. And it said, okay, how does the tooth function with these 3 different types of materials? And they found, again, that the indirect resin far outperformed your direct resin composites, but also was very comparable to Emacs, or lithium disilicate, especially when bonded to the tooth structure. Another thing that we know about printed dentistry is that the fit is just better. Most of the crowns that we are receiving from labs today are milled in a 5-axis milling machine, and they're constrained to the burr angulations and the nesting when they are creating these crowns for you. And 3D printing, it can print up to 50 micrometer resolution. That is so tiny. They're able to get incredible detail that isn't constrained to a milling machine. And let's talk about the contact for just one moment. This is the most frustrating part to me of adhesive dentistry today. And they have come up with so many solutions to try to make this step easier for all of us. They invented the garrison ring with the sectional matrices. They then invented multiple garrisons that can stack on top of each other to help you through this process. They made them clear so you could possibly see it better. And then they also created some of these contact adapters to try to figure out, well, how do we get that contact to be perfect? And with printed dentistry, wouldn't it be nice to be able to get that result every single time for every single provider? And the reason why I bring this up is, again, we have to have a huge armamentarium to be able to complete direct composite restorations efficiently. And I haven't mentioned the crown word yet, because patients are wanting more and more conservative treatments. We live in a small nightmare in that patients are coming educated to our practices. They want conservative therapies. The inlay and onlay market is projected to triple by 2030. That should give us some pause as well. We are providers, but we're also business people. This is something that we could look into integrating into our practice to be able to give, again, cost-effective care to our patients. Additionally, it requires less of an armamentarium, and also, at the end of the day, a single unit from your printer, if you've paid your printer off, is less than $10 a unit, less than $10 a restoration. What is the biggest downside? I've been sounding like a salesperson this whole time. I'm a skeptic just like you. The biggest downside of these restorations is that the wear resistance has not been great. Up until 2024, actually just last year, there was not a single study, a single independent study that said, yes, you can use printed restorations for crowns and onlays because the wear resistance is poor and it should only be used as a provisional material. This should sound relatively familiar if you even looked at printed dentistry into adopting it into your practice. But while I was working on this restoration, or on this presentation, in February of 2015, in our own Journal of Prosthodontic Dentistry, there was a study that was published showing that 3D printed crown materials demonstrate less wear than lithium disilicate and created less opposing enamel wear. This was pretty surprising, and it's only one study, so of course take that with a grain of salt, or 5. But it's showing that printed dentistry is continuing to evolve, and with continued innovation comes improvement, and we're seeing those improvements today. So you might ask me, all right, Dr. Greta, maybe you convinced me, I'm thinking about doing this, what material should I use? And unfortunately, there is a plethora of them. It feels like there's a new material that comes out every couple of months saying, I'm better, I'm the best. So in a world of shifting sand, it is best to know the map when you're trying to navigate this. So I'm going to go into a little bit of a primer on these types of materials and how you as a provider yourself can evaluate them as they come out and see if you want to adopt them. So the first question is, what exactly are imprinted resin ceramics? And the answer is, nobody really knows. Because it's a very sexy, booming, competitive market, and all of these materials are proprietary to each company. So instead of speaking exactly about what is in them, I'd like for you to think about this as a generation 1, 2, 3 types of resins. The first are, of course, direct resins. We know that when you cure these in the mouth, you get up to a 60% cure only. This was one of those areas where technology tried to innovate, and they came up with milled ceramo resins. These are milled compressed blocks of composite materials, and they found that they seem to be overprocessed and weren't repairable. So again, this is another place that we have tried to innovate in printed resin ceramics. And we're just going to talk about, again, what we should, something has happened here. All right, well, we should talk about how they are different instead of what they're made out of. So first, printed resin ceramics, if you post-process them appropriately, they have up to a 95% cure rate. That is such a dramatic difference than 60% cure in direct composite resins. Than direct resins. There's no monomer leaching. Again, you have accurate prints, better fits, and they found that because of the way that these materials are made and processed, they are bondable and repairable. So knowing this, we should talk about biomaterials. Please don't fall asleep on me. I'll keep it short and sweet. When we're looking at these materials, these companies will tell you a lot of numbers. Our flexural modulus is this. Our fracture toughness is that. And it's really important to understand fully that composite resins that have ceramics in them will never be like Emax, and they will never be like zirconia. And when we're looking at our ceramics, we usually love to look at this number, flexural modulus, which is the material stiffness when bent. Resins have a certain amount of shock absorbance, so they will never score as highly as a ceramic. Fracture toughness, we all know, zirconia taught us this lesson in Zirconia is King, about fracture toughness. And Heinz et al., Bustamante Hernandez, and Zimmerman, and I hope to meet all of these people one day, this would be great. They all discovered that for the success of posterior resin restorations, fracture toughness is actually the biggest leading indicator for success. And when talking about these materials, again, it's good to compare and contrast them to the materials that we like to use today. And again, flexural modulus, like I mentioned, it's low comparatively to all of the other materials that we use. But the interesting number is here in fracture toughness. A food for your thought is we keep searching for a material that seems to be indestructible in the mouth, zirconia being one of them. But we should be thinking about restoring a tooth with tooth-like materials. such that the tooth can continue to act like itself. And in this area where Emax is king for fracture toughness, you'll notice that our printed materials, two of which I have here on the screen, score a little bit closer to that of our dentin properties and our enamel properties versus zirconia, which scores much higher. And then in shear and yield strength, which are both indicators of the function of the material within a tooth, you can find that they also score closer to that of enamel and dentin. So something to consider when you're looking at these materials, and could they be definitively used in a tooth? There are limitations to every single material we use. Again, innovation is trying to make this improved, and we're going to talk about that. The first is the printers themselves. Again, everything is changing quickly all of the time. It's hard to decide at what price point you want to come in. Printers all in are about $35,000 to $40,000, which includes the scanner, the carrying unit, some resin trays. And it would be up to you to decide. I have not been incentivized by any company to talk about any particular printer itself. But, yes, they are technique sensitive in that you have to stir the resin, and that means you don't know how many ceramic particles are in each one of your restorations. Sprint Ray is developing the new generation of printing, which is called the Midas. It's a pressed stereolithography, so it's a certain amount of resin that's extremely highly filled with ceramic. It comes out of this cartridge and is cured at the same time and can print a crown in under 10 minutes, which is pretty impressive. And it may be the next same-day dentistry standard of care. And I would like to press play. These materials, again, they're very sexy. They make all of these ads to try to convince you that this is the best, biggest, strongest material and you should be using this. But you should take this again with a grain of salt. This is a show for the On X2 by Sprint Ray, and there's not a single clinical independent study on this material. And this is what a lot of general practitioners are using for their restorations, and they're not telling their patients that there are other alternatives. So also something to consider. The one study that I could find on the Sprint Ray On X material is just this one independent study saying that for 15 patients who received an implant-supported denture made out of this material, they had a 20% catastrophic failure rate. So this is an improvement from the days of old where we were using metal-acrylic hybrid restorations, but we're just not quite there yet. But don't let that scare you. This is meant to be a primer into something new. And then, of course, we have 3D printed dentures. I will let Brian and his father talk to you all about that. The Goodacres are really pushing the envelope on 3D printing in schools and also in the real world. Some of their limitations that we are not sure about, the stains and glazes used to characterize the dentures, are, it just depends on how long that they will last. So still underperforming from polymethyl methacrylates, but can be considered definitive for some of our patients. So in short, I have made some choices for myself. You get to make these decisions on your own. I think if direct composite veneers can be considered definitive, printed veneers can be considered definitive. Same thing with dentures, class 1 to 4 restorations. Inlays, select onlays. Again, wear resistance is still a very, very big question for me for full coverage restorations. Crowns, I'm still a no on. I would love to see more clinical studies on this. And then, of course, for the implant-supported dentures, I'm still not on board. That flexural modulus number is just too low to be rigid across so many implants. And then again, if you're looking for a machine that's very efficient, you can do so much with a printer. You can make a diagnostic wax-up and you can print it and have it. If you're an orthodontist, a lot of orthodontic aligners are now 3D printed. You can make Essex retainers. You can make single tooth treatment partials. There's just a plethora of things that you can do. This is just meant, again, to be a primer for you. In my last minute, I would like to just say, evaluate your own conscience. There are 4,000 prosthodontists in the world, and there are so many patients who need our help and who may not be able to afford the Ferrari that is your treatment plan. And if you can deliver a smile to them that can be partially long-lasting, they will come back to you for the replacement. A brief thank you slide in my 39 seconds. This is working out amazing. First to Dr. Solnit for getting me onto the stage. I could not do it without you. I'm very grateful for this opportunity. To Dr. Sadowski, he met with me on Monday and helped me make this presentation more accurate, precise, and efficient for everybody today. My fiance Kyle, who has seen me stress out about this. Tingling Chang and Dr. Exler for recommending me for membership. This is Stephen Au, biomaterials expert. He looked over all of my numbers to make sure I wasn't telling lies. And this is Wally Renee on the left. If you have any interest in printed dentistry, they're actually holding the MOD Institute in Las Vegas this weekend as well. And he's really a forerunner in printed dentistry and has published, and he's quite amazing. And then lastly, to my little brother, he's a D2 dental student. The theme of the day is inspiration, and having another dentist in the family, I will say, inspires me to try to master excellence and to become a better clinician every single day. So find your inspiration. May you continue to evoke change in your practice and make better decisions for yourself and your patients. Thank you very much.
Thank you, Greta, for a great presentation and a small token of our appreciation. Great job.